Hi, welcome to this edition of the Fast 5 FAQs, where we take 5 of the most common questions on various topics like benefits, HR, wellness, and in this edition, common questions from employees about PPACA or healthcare reform. So let's get started. First question, is there a difference in all these names for the same law? Whether you refer to it as healthcare reform, the Affordable Care Act, PPACA, or Obamacare, it's important to remember these are just different names for the same law. And if you're communicating with employees, being consistent helps in that goal. Second, what is healthcare reform going to do in 2014? Big question. One of the main goals is to limit the number of Americans without health coverage. It's going to be done in various ways, for instance, requiring most Americans to have some type of health insurance, or they will pay a penalty, and making it easier for individuals to obtain coverage. This is going to be done by creating insurance exchanges or marketplaces, places for them to be able to buy these insurance coverage, encouraging larger employers to provide coverage to all full-time employees if they're not already doing so. It's also about making it easier for people who have medical problems to get the insurance they need. Question number 3. What is the requirement to have health insurance? Quite simply, most Americans and other people legally in the U.S. must have minimum essential coverage, or they will have to pay a penalty with their federal income tax return. You may hear this called the individual mandate. So the next question is what is the minimum essential coverage? Minimal essential coverage is basic medical coverage, and it can be provided by a number of resources like your employer, various government programs, or an individual policy, which can be purchased through or even outside the exchange. The last question we're going to cover today is what if I can't afford coverage? No penalty will apply if the cost of the least expensive health plan through your employer is more than 8% of your household income. Other types of assistance, such as Medicaid, may be available to employees with low incomes. These Fast 5 FAQ questions were from a complete larger employee guide on PPACA or healthcare reform. If you want the complete guide for free, comment, click, or call. We'll get it to you fast. Thank you.